Here's a detailed overview of dopamine, organized according to your requested headings. Show 1, generic name, drug class, brand name, generic name, dopamine, drug class, inotropic agent, vasopressor, adrenergic agonist, specifically dopaminergic and beta-adrenergic agonist. Brand names Intropin, discontinued in the US, Dopastat, and generic formulations available. 2. Definition. Dopamine is a naturally occurring catecholamine that functions as both a neurotransmitter and a medication. In its drug form, dopamine is used intravenously to treat hemodynamic imbalances such as shock, low blood pressure, and heart failure by improving blood flow and cardiac output. Mechanism 3. Mechanism of action. Dopamine has dose-dependent effects. Low doses, 1 to 2 mg/kg per min, stimulate dopaminergic receptors, causing renal and mesenteric vasodilation, increasing renal blood flow and urine output. Medium doses, 2 to 10 mg/kg per min, stimulate beta-1 adrenergic receptors, increasing heart rate and myocardial contractility. High doses, 10 mg/kg per min, stimulate alpha-1 adrenergic receptors, causing vasoconstriction and increased blood pressure. 4. Indication. Cardiogenic shock, septic shock, hypotension, especially with low cardiac output, congestive heart failure and acute decompensation, to improve renal perfusion, low-dose use, though controversial. 5. Contraindication. Pheochromocytoma, uncorrected tachyarrhythmias, e.g. ventricular fibrillation, hypersensitivity to dopamine or any of its components, use with monoamine oxidase inhibitors, MAOIs, without dose adjustment. 6. Before taking this medicine, precautions. Inform your healthcare provider if you have heart rhythm disorders, peripheral vascular disease, diabetes, asthma, or sulfite allergy, history of MAOI use within the past 2 to 3 weeks, cold extremities or signs of reduced perfusion, pregnancy or breastfeeding. Note: dopamine is typically used in a hospital setting where patients are closely monitored. 7. How to use. Administered intravenously via continuous infusion using a controlled IV pump. Central venous access is preferred to reduce the risk of tissue necrosis from extravasation. Dosing is weight-based and titrated according to the desired hemodynamic effect. 8. Dosing information, adult example. Initial dose, 2 to 5 mg/kg min IV infusion. Titration. May increase gradually in increments of 5 to 10 mg/kg min every 10 to 30 minutes as needed. Maximum dose, typically up to 20 mg/kg per min, sometimes higher in critical situations. Renal dose dopamine, 1 to 3 mg/kg for renal perfusion, controversial use. 9. Missed a dose overdose. Missed dose, not applicable, administered by continuous IV infusion in medical settings. Overdose symptoms: severe hypertension, tachycardia, arrhythmias, chest pain, tissue necrosis from extravasation, hypertensive crisis or cardiac arrest. Treatment: discontinue infusion, supportive care, use of FA blockers or vasodilators as needed. 10. Stop or avoid taking. Avoid or discontinue if severe arrhythmias develop, excessive vasoconstriction occurs, e.g. cold extremities, cyanosis, blood pressure becomes dangerously elevated, extravasation occurs, treat with phentolamine infiltration. 11. Side effects in detail. Common: nausea, headache, tachycardia, palpitations. Arrhythmias: ventricular tachycardia, fibrillation, chest pain or myocardial ischemia, severe hypertension or hypotension, dose-related, tissue necrosis or gangrene from extravasation, dyspnea, anxiety or nervousness. Local reactions: phlebitis at IV site, extravasation leading to severe tissue damage. 12. Vital information. Requires continuous cardiac and blood pressure monitoring. Always diluted before IV infusion, administered only in a clinical setting. Central line preferred for long-term or high-dose use. Ensure urine output and renal function are closely monitored. Avoid abrupt discontinuation in unstable patients. Taper gradually if needed. 13. Other drugs will affect dopamine. MAOIs, e.g. selegiline, phenelzine, potentiate dopamine effects, contraindicated or used with extreme caution. Tricyclic antidepressants, TCAs, may enhance pressor effect. Beta blockers, e.g. propranolol, may antagonize inotropic effects and increase peripheral vasoconstriction. Diuretics may increase hypotensive risk. General anesthetics may increase risk of arrhythmias. Ergot alkaloids may increase vasoconstriction. Phenytoin may cause hypotension and bradycardia when used concurrently. Let me know if you want a nursing care plan, infographic summary, or mnemonics related to dopamine use.